Okay, we're going to get started. On behalf of the Planning Committee, we warmly welcome you to the Children's Tumor Foundation 2021 Virtual NF Forum. We're glad you could join us tonight. I am Trace Ann Rose, CTF's Director of Patient Engagement. We're very disappointed to not be able to host an in-person meeting again this year due to the pandemic, but we're pleased to bring you 2 days of programming tonight and tomorrow in place of that in-person event. So it seems appropriate that this evening's meeting will focus on healthcare access and the pandemic. We're going to get started with some housekeeping. This webinar is being recorded, so please mute your devices if you're not speaking. We're providing closed captioning. Click on the CC button at the bottom of your screen to access that. We're also offering live interpretation, Spanish interpretation during this meeting. Please choose the language you wish to hear by clicking the interpretation button at the bottom of the Zoom screen. This instruction is also available in the chat. Everyone, including English speakers, must choose a language. Do not stay in the default off. Remember to also do this tomorrow for each Zoom session you join. I would like to thank our financial sponsor, AstraZeneca, who for the past 2 years have supported this meeting. You will hear us thanking our co-chair several times, and that's because to put a meeting of this magnitude together, it's not a small task. To that end, I'd like to thank co-chairs Dr. Robert Listner from Ann and Laura Children's, Dr. Verena Stadke from Johns Hopkins Medicine, and Daniel Bonidis, patient representative, for their valuable and thoughtful wisdom and guidance in planning the content for this meeting. We have an exciting program planned this weekend that will allow you to celebrate our accomplishments, get practical tips for managing NF, and jointly explore current and future research directions in NF. We hope you'll have a productive time at this very special virtual conference. You will now hear from Annette Backer, President of the Children's Tumor Foundation, about the mission and vision of CTF. Thank you.
Good evening, everybody. And first of all, I really would like to echo Trace Ann's thanking of the co-chairs that have put this very interesting program together. I just wanted to add 2 people of our people, that is Trace Ann Rose and Kate Gell. So thanks, guys, for putting this really cool program together. When I'm reflecting on the forum, we're looking back about 10, 12 years now. And it started as a very small family gathering, and look at where we are today. I always would like to say tonight and these next few days is characterized by 3 E's. The E from educational, the E from empowering, and also sometimes the E from emotional. So with that, I'm really super excited to kick off this forum. As you know, CTF stands for 3 main things. 1, we're really investing in research and making sure that the best and brightest gets the funding in order to advance the care. The second is to make sure that the investments are actually translated in better treatments for patients, although this sounds very logic, but it's very often not happening. And the third one is really building communities that can accelerate both better care and better cure. And tonight is again once a demonstration of such a community coming together, patients, clinicians, researchers, people from companies, people from regulators. So thank you so much for being here tonight, and have a wonderful weekend. I have a little excuse. Tomorrow, I'm unfortunately not be able to be with you because my son is graduating, but I will definitely look at the recording. So have a wonderful day and a half, and I can't thank everybody enough for this great event.
Okay, I think it's my turn now. I'm Bob Listernick. I am a co-director of the NF clinic at Lurie Children's of Chicago. The co-chairs will tell you a little bit about ourselves as the meeting goes on tonight and tomorrow. But first, it is my distinct pleasure to introduce one of our keynote speakers for tonight, Dr. Donna Shanazi. Dr. Shanazi is an attending physician in the Division of Emergency Medicine at the Anna Robert H. Lurie Children's Hospital of Chicago. She's an assistant professor of pediatrics, and she's the founding medical director of our telehealth programs at Lurie Children's Hospital. I will just give you some insight into how important Dr. Shahnazi has been over the last year during the pandemic. Basically, she and her team rolled out in a month's time what was going to be at least a 3-year endeavor. This allowed us to provide care for all the children in the various departments in our hospital. So we are all incredibly appreciative of Dr. Shahnazi. I know she's going to give us a wonderful talk. For you, Dr. Shahnazi.
Thank you very much, Dr. Listner, for that kind introduction. So good evening, and thank you to Dr. Listner and the planning team for inviting me to join you here. While I have had the privilege of caring for children with NF over the years when they present to the emergency room, I'm by no means an expert and have much more to learn from all of you. What I do bring is experience in telehealth, which, as you are all aware, has become much more widespread in the face of COVID. I wholeheartedly believe that through telehealth, we have the opportunity to break down traditional barriers to care. And I look forward to sharing my perspectives with you over the next 30 minutes or so, followed by hopefully the opportunity to hear from you whether and how this resonates with you and what applications you see for the NF community. At the end of the day, the goal here is for us to come together with our various experiences and expertise and learn from each other so we can make the world better for those around us. So this quote I want to lead with really resonates with me. Be the change you want to see in the world, which is attributed to Mahatma Gandhi. To me, it means that if we want to see meaningful change across the system, we have a personal responsibility to do our part. My slides will conclude with this quote, but I do want to share with you why I chose to lead with it, and specifically why a version with a bumblebee. It's an image that has meant a lot to me over the last few years, especially. My son started having seizures when he was 5. And I found for myself some comfort in the symbolism that while something may sting, there's also beauty to be found. And so while the pandemic has forced us all to adapt and adopt new ways to go about life, I think it's given us the proverbial lemons, and we have had the opportunity to make lemonade, finding new ways to ensure that we maintain connections and ensure that our loved ones still receive the care that they need. So here's what I'm hoping we can accomplish together this evening. First, I want to start by just getting on the same page about what we mean when we say telehealth, followed by what does telehealth add? Why is it so important now? There's certainly challenges to adoption, to use, to sustaining this model of care delivery, and I want to review those as well as some strategies to overcome them. And then finally, I want to get into some advocacy opportunities, both at the individual and systems level, what you can do to advocate for yourself, for your loved ones, your community as it relates to telehealth. What I see as my role is really to help empower you to understand what's out there, understand what's possible, but also recognize what the limitations are and frankly, what the hindrances are. We will have some time at the end for questions and to hear about some of your experiences if and as you're comfortable sharing. So, traditionally, when we think about telehealth, we really do think about video visits, right? I want to take a moment to express my gratitude to those of you that have your video on, but also talk for a moment about what video adds. It makes such a difference to see eyes, faces, to see the nonverbal cues. There's really a difference that I have between talking at you and sharing with you. And I think this is something we've all experienced through the pandemic. For those who have been working or those attending school, conference calls have turned into video conferencing. And how good has it been to see each other's faces, full faces, without masks? Socializing with family and friends even, especially early in the pandemic. How many of you started receiving or perhaps sending invitations for video calls? I think phone used to be our go-to, and we're so much more comfortable with video now. I think we've all had the experience in one way or another where somebody's calling us on the phone and asking us for advice, wanting to know, do I need to worry about something? And I think about my experience as a pediatric ER doctor. Somebody might call me and say, hey, my child just fell off the playground equipment. Do I need to worry? And I'm starting to paint a picture in my mind's eye of what it is that they're describing. And I use, the words that they're using to paint some imagery for myself. I might listen to the tone of their voice, the pressure of their speech, and also kind of access the different things I know about them. Are they somebody who's not easily rattled? But all these things I do as I'm listening are painting a picture in my mind's eye. And at the end of the day, I'm connecting dots and making assumptions. So what does telehealth bring to the table then? It adds additional data that helps us make those connections and helps us make better decisions. At the end of the day, it is a tool. It is a tool in our toolkit. It is not intended, and nor should it ever replace in-person care, but there is a role for it. And that's what I hope we can really get to today. So let's just get on the same page about terms. Telehealth is certainly not new to most of you. I just want to get some definitions out of the way. So telemedicine is the remote delivery of healthcare services and clinical information using technology. Telehealth then is an umbrella term that encompasses telemedicine and these additional applications: education, research, advocacy, public health. For all intents and purposes, telehealth and telemedicine can and often are used interchangeably. But really, technically, telemedicine refers to these three modalities of care delivery. And those are the pillars listed starting on the left. It's real time, and what's really most recognizable to people as video visits, otherwise known as synchronous visits, like in real time, asynchronous or store and forward, and remote patient monitoring. I think we mostly think about synchronous video visits when we think about telehealth, and that's the majority of what I'm going to be talking about. But we'll also touch a little bit on opportunities in the asynchronous and remote patient monitoring space. All right, so there's no question that the pandemic has exposed deficiencies in our healthcare system. So if you look on the left, the traditional model of care delivery is often quite fragmented. We've always just tried to piece together the right provider, the right care at the right place and time around a patient's needs. There are health system deficiencies that to many patients and families with chronic conditions have been quite obvious and challenging for a long time. And in many ways, the COVID pandemic exposed those deficiencies to the broader audience, as it really forced an abrupt shift in how we deliver healthcare to meet the needs of patients, of staff, and of communities. And I think what many have seen by integrating telehealth, now recall it's a tool to support and augment, but not replace in-person care, we've seen through telehealth that those puzzle pieces can actually better fit together, and we can better line up the right care by the right provider at the right time and place for each patient. So through the pandemic, we have definitely seen a surge in telehealth use. Historically, telehealth for outpatient appointments was relatively low across the US, and we'll talk a little bit about why. But in the face of the pandemic, in order to continue functioning while protecting everyone from disease, we really had to make an abrupt transition to remote video conferencing and other digital solutions. We really saw a pronounced upward tick, and you can see that in this graph here, and it was really by necessity. And you see that there's some fluctuations, the numbers have gone down a little, but it's still sustained as high. So I want to talk a little bit about why. And I would say, I think it kind of makes sense. I mean, if you think about it, technology's permeated our lives and every other space. It's actually healthcare that's lagging. If you think about the way we shop, if you think about the way we shop for clothes, for shoes, for groceries even, these are so many other examples. But really, it's about time that we as consumers of healthcare demand the same level of service in healthcare that we receive in other sectors. And certainly, it's gaining acceptance. I found this magazine article, and telehealth itself is not a new concept. And when you look at the image on the right, communicating and having our care relationships through technology is just such a pervasive part of today's culture. And we are the healthcare consumers. So certainly through the pandemic, providers, hospitals, doctors, nurses, we've all been exposed to telehealth. And I will tell you, many not by choice and many were not very happy about it, but acceptance has slowly followed. I think interestingly, in a mid-2010s survey on pediatricians' experiences with attitude towards telehealth, only 15% of primary care pediatricians reported any sort of telehealth use in the prior year. I would bet you'd be hard pressed to find a single pediatrician who hasn't offered it in some capacity over the last year. Similarly, a survey of NF member clinics found that over 80% of those that responded to an informal survey offer some virtual visits. So the acceptance is definitely there, at least the exposure, which leads to acceptance. I do want to just review some of the historical barriers cited by clinicians as to why offering telehealth has been challenging. And when I say historical, I really do mean pre-pandemic, because a lot of the restrictions have been lifted during this time of public health emergency. And I will talk about that on the next few slides. So this is one survey, but the categories of barriers are really the same across different industry and academic studies in both adult and pediatric populations. So first and foremost, the lack of third-party reimbursement far and away are the greatest cited barrier to providing telehealth care historically. This is really followed by state licensing requirements, and then there's technology, institutional support, concerns about quality of care delivered. These are just a few of the other perceived or real barriers that clinicians have and have had in adopting telehealth in the past. So it's really important here to take a moment and dive deeper into what actually drives telehealth. Traditionally, clinical workflows and economic incentives have largely been developed to support and reinforce a face-to-face model of care. But there are laws and regulations that govern the provision of telehealth services based on location of patient, of provider, and the insurance's willingness to pay for it. Telehealth policies and procedures are really driven at the federal level by CMS, which similarly informs Medicaid programs and commercial payer decisions. The bulk of telehealth policies and regulations, though, are enacted at the state level, and no two states are alike in how telehealth is defined and regulated. This creates a really confusing environment to navigate. The maps here give you a glimpse into how everything in telehealth varies state by state. I would say pay less attention to the details because these are constantly changing, and I'm grateful for that. And I will share with you a resource a little later on that you can get to know a little bit more about the regulations or allowances in the state that you live in. But needless to say, many states have restrictions on specialty type, on types of services that can be reimbursed, whether it's office visit or inpatient, on the type of provider, on the location of the patient. Additionally, there's state-specific policies around consent, around credentialing. There's nuances and differences across state lines related to prescribing over technology, whether you need an established patient and provider relationship. And some states actually issue special licenses related to telehealth to allow an out-of-state provider to render services. So that's just a kind of a glimpse and an overview of what some of the traditional legislative barriers have been. But as the healthcare systems nationwide faced a surge of COVID cases, urgent action was required to transform healthcare delivery and to scale up systems. So Medicare enacted flexibilities, eliminating certain restrictions, a lot of the restrictions that I just reviewed, and similarly at the state level, Medicaid followed. Importantly, many of these changes led to the elimination of geographic restrictions and the expansion of CPT codes that are eligible for payment. I think one really noteworthy trend is the expansion of providers. So teledentistry and then other allied professionals, specifically physical and occupational and speech therapy, were areas where reimbursement was noticeably expanded. I'll say to summarize the key changes that were made by CMS, and then again, everybody followed, were really paying physicians at the same rate for telehealth services as they do for in-person visits, that patients can be in their homes or any other setting to receive telehealth services, so getting rid of some of those restrictions, that patients don't need to have an existing relationship with a physician who's providing the telehealth service, that physicians are allowed to waive or reduce cost sharing for telehealth visits, and importantly, that physicians who are licensed in one state are allowed to see a patient in a different state. But that all to say, what's next? Maybe, and hopefully, we're nearing the end of the pandemic. Many states have started to codify these changes and make some of them permanent. Others are still working through it. Again, I will share with you a resource so you can check on what's going on in your state. And so with patients and providers alike having newfound exposure to a new way to deliver care and receive care, and with laws and regulations adjusting to allow for this to happen, what's the future of telehealth? Here's an article from the Chicago Tribune from last fall highlighting the positive impact of telehealth. And, you know, the future of telehealth remains uncertain because it's really unclear as to which visits will be covered by insurance after the public health emergency ends. The big question is, are virtual medical appointments here to stay? So Seema Varma, who is the former administrator for CMS, was quoted in the Wall Street Journal saying that thus far, evidence does show that telehealth has the capability to address these barriers, to improve health outcomes and care coordination, to decrease costs and to reduce health disparities. By and large, we're hearing that same thing from providers and from patients who want to continue using telehealth in some capacity, mostly motivated by the experiences that they were kind of forced into through the pandemic. So to answer the question, telehealth is here to stay. So what are people saying? I'm certain that each of you have your story, your perspective, your thoughts, and I wish we had more time and frankly we're in the right forum to do this interactively. I do hope that we take advantage of the Q&A portion and allow you to share some of your stories, reflections, challenges, but I do want to share with you some that we've heard. So certainly the home environment offers unique opportunities to really understand some of the social determinants, to understand what patients are dealing with at home, what's possible and what some of the challenges are. We've definitely heard from some patients the feeling, the perception that they have more time face-to-face over a screen than they would if they were coming in and out of a busy clinic. Certainly, the ability to have multiple parties join in from different locations has been really helpful. The convenience has been really, really important to people. Patients with medical complexity or chronic illnesses who have to see multiple specialists or maybe have some tests done, the days are long when they have to come and have all their visits. And so if some of those long days can be split up by doing some of their visits at home, that has been a win. But we've also heard from people that they miss the physical interaction, and maybe that'll change when we're back to interacting with people more as the pandemic. Hopefully we're nearing the close of that, but there's definitely things missing in a telehealth visit. We've heard from clinicians and actually from patients alike that the blurring of home life and their medical life, they don't like that. And then, over and over we hear, telehealth is not that hard, it's not that complicated, but it's also not totally straightforward. So I want to get a little bit into the details related to what telehealth adds then and what is challenging. Again, I know I say this over and over again, but it really is just a tool in our toolkit. We have seen that telehealth is an extraordinary tool. It's convenient for patients. It's convenient for providers. That's probably the most common cited attribute, convenience. You save on parking. You can save on childcare, save on missed work. And with convenient comes access. We overcome the barrier of geographic distance. You can reach expertise that's not available in your local community. You can cross state lines. You can save on transportation. There's also the advantage of multi-party visits, bringing in other caregivers or even bringing in other providers. But what about accessibility? Language interpretation has been challenging with telehealth. For patients who are hard of hearing, sign language interpretation can be facilitated via video, and some platforms have the ability to integrate closed captioning as we have here, but not all do yet. And then there's the additional issue of privacy. Very basically, do people have a private space in their home to do this? And then there's also internet privacy and security. And with all of that comes a risk of fraud. That's certainly a concern that's been raised by insurance companies. The other really big risk is silos. So the convenience of technology has a real risk of fragmenting care. It's important that we use telehealth as a tool to bring people together with their care teams and support network and reinforce the patient-centered medical home, not fragment it. And finally, and I think really importantly, is quality of care delivered. And we're going to talk a little bit about that and how to think about quality of care through telehealth. But really, ultimately, we need safeguards to prevent fraud, to preserve quality, and to ensure that we don't leave behind low-income patients and communities with less access to technology, or that we don't leave some with only virtual options in place of physicians. I want to spend just a little more time on access to care and specifically on access to subspecialists. So this is probably an incomplete schematic of the web of interactions with a subspecialist in different forums. But telehealth doesn't have to just be from your home or with a follow-up appointment. Telehealth actually helps us connect providers to each other. I recognize that there's a paucity of NF specialists nationally, and some people have to travel far for a diagnosis or for ongoing care. So some of the possibilities include connecting a specialist with a community hospital, to connect a specialist with a primary care office. The goal here is to support the patient-centered medical home and not fragment it. So coordinating care with the primary care provider, coordinating the testing. One interesting thing to call out is Project Echo, which some of you may have heard of, but it's really not about delivery of care, but rather delivery of education or telementoring. So the Echo model basically uses a hub and spoke knowledge sharing approach where experts expert teams can lead virtual clinics and amplify capacity for providers without that specific training to know what the best practices are to be able to serve patients in their own communities. They have all sorts of programs. The list is growing. And as of last check earlier this afternoon, they don't have any NF programs yet, but I think that's an opportunity. Okay, so all of this works and is great if we do it right. So what you see here is what you don't want to see in your physician, which is a really messy background and they're kind of moving around a lot. We've all seen blooper reels of virtual meetings gone bad. And there's virtual visits that could go better also. It's a really important skill that we teach clinicians. It's actually one of my favorite things to talk about, but it's our virtual presence or professional appearance via electronic transmission. I mean, at the end of the day, the clinical care is mostly the same. It's not exactly, and we'll talk about that a little too, and I'm sure you've experienced this. There are differences, but first and foremost, we need to think about how we on the provider end are showing up. At the end of the day, bedside manner is not the same as website manner. So website manner, virtual presence, again, one of my favorite things to talk about. Now that we're 15, 16 months into this pandemic, most people have become really good at their screen presence or virtual presence. So I only emphasize a few things. When we think about privacy, we also have to think about perception of privacy. What's going on behind me? I can assure you I'm in a private room, but you're losing situational awareness. And if you see me looking away every once in a while, how do you know I'm not talking to somebody next to me? And so it's about being really explicit about our surroundings and what's around us. I think the other thing that's really important to call out is eye contact. I think we as humans have a natural affinity for looking at people's faces. And when you're looking at a screen, their face can be a few inches away from the camera. So if I'm continuing to look down and look at your face, I see what you're doing, but you think I'm disengaged or I'm not really looking at you. And that matters when we're talking about sensitive things or we want to convey compassion. So just a few interesting things on website manner. The patient assessment, I think, is also something we could spend hours on. As we talked about early, a picture's worth 1,000 words. There's tremendous benefits to seeing each other, but there's also challenges to the physical assessment via telemedicine. What I have here is a screenshot of one of our own institutional toolkits that we developed, and there's plenty out there on how both to train providers and to coach patients and families on the observational physical exam. Aside from the addition of what are called peripheral devices, so like a digital stethoscope you have at home that you connect to your smartphone or computer, or blood pressure cuff, really the mainstay of the physical assessment via telehealth is considering how to best use our observational skills. And in the pediatric patient, it's how to engage the helper, the person who's with the child. But then really a lot is actually possible. I want to highlight a few specific components of the patient assessment. In the overall neurologic assessment is very possible. We can assess balance, you can assess coordination. However, the assessment of something like hearing may require additional tools. So interestingly, teleaudiology has really soared during the pandemic. Many hearing aid brands have come up with an accompanying smartphone app that the audiologist can download. And there's really promising results on research on usability and validity of these teleaudiology devices. Pain is another interesting component of the neurologic assessment that is actually really amenable to remote monitoring tools and consumer digital health, really enabling the patient to generate their own health data in real time to be shared digitally with their provider. So this is where we start to think outside the box on how we make our assessments and gather data as clinicians. The skin exam deserves special mention. It can be challenging, and long before the pandemic, people recognized the opportunity for telehealth assessment of skin conditions. Teledermatology was starting to take off before the pandemic. And it's actually during the pandemic proven to be really challenging on video visits. The technology platforms continue to work on improving their resolution, but it's so often dependent on internet connection that it's really hard on a video visit to see. So I think one option and one workaround that a lot of people have come up with is the asynchronous or store and forward, meaning taking a photo and uploading it through a private or HIPAA compliant platform into a portal for their physician to be able to review it prior to or during the video visit. I think it's also worth noting that telehealth has been really transformative for mental health services. There's been a tremendous decline in missed appointments because we don't need to get everyone out of the house or travel. There's better medication adherence, and patients are in a more developmentally comfortable environment in their own homes. So it's really a matter of learning what works and what doesn't, and thinking outside of the box on how to make it work for your care plan and for your patients. So it brings us to this. What does the future hold? The pandemic has shown us that the future is hybrid. Everyone wants to do some sort of blended approach for this to continue in some shape or form. Just like for school, just like for work, the hybrid model gets some things right, and there's still some things we're working out. So we need to find the sweet spot. And I think we need to rely on data to be able to do this. In healthcare, we need to show that outcomes are not inferior. And in fact, we may actually make up for it with time saved, with patient satisfaction, with improved access to care. We do recognize that telehealth is here to stay and that there will always be a need for, and frankly, a desire for in-person care as well. So what is our way forward? I think it hinges on three key areas: education, legislation, and outcomes. Ultimately, these each overlap with legislation, as education and evidence of clinical outcomes are going to be what's required to drive legislation to keep the good parts of telehealth around. Education is required on all sides: providers, patients, hospitals, clinics, as what's the best way to deliver telehealth care? What's the optimal time to do it? What are some tips for getting the most out of a telehealth visit? In addition, guided practice models like Project Echo that I told you about can help reduce health disparities in underserved and remote communities that lack access to care and provider-to-provider education. But legislation really is the key. It requires both at the federal and at the state level. A starting point is to codify many of the flexibilities that were enabled during the pandemic, and to make them permanent. And then finally, there's clinical outcomes. And I think this is a really interesting one. So telehealth is effective. But is it because of something we said or did on the telehealth visit? Or is it just because of the fact that it was just easier to connect? It was easier to see each other, to get the right provider with the right patient for the right care at the right place and time. So I want to spend just a little bit of time on clinical outcomes. I want to share with you two frameworks that people are using to organize their domains for clinical outcomes. So you may have heard about the IHI's triple aim, which is improving the health of populations while reducing costs and improving the patient and family experience. It turned into the quadruple aim with the addition of prioritizing the well-being of the care team, really to address provider burnout. And more recently, I've heard it referred to as a quintuple aim, bringing in addressing of inequities in care. I would suggest, and I would hope that after our brief time together this evening, you agree that telehealth addresses each of these. Another tool for looking at how we assess quality of telehealth care is provided by the National Quality Forum. So they offer a comprehensive guide for developing telehealth measures under 4 domains: access to care, financial impact or cost, experience, both provider and patient experience, and effectiveness. And they have over 50 measurement concepts within those for anyone who's interested. So thus far, evidence has shown that telehealth has that capability to address barriers, to improve health outcomes and care coordination, to reduce costs, to reduce disparities. But ultimately, the evidence is going to be what we need to drive legislation to keep the good parts of telehealth around. So as we look ahead into the future, here's what I hope you take away. We've seen that telehealth is an extraordinary tool. It's convenient for patients, it's convenient for providers. Now we just need to make sure that it's sustained and enduring and used the right way. But we need all hands on deck. We need to bring patients to the table along with the clinicians and researchers. The patient voice has to be there. We need to continue to recognize the risk of technology and the convenience that comes with it to fragment care. And we need to develop and invest in programs that bring care teams and communities together. And lastly, notice that I've hardly said a word about technology. It is only the enabler. It brings us to the table. It gets us thinking and reimagining and reconceptualizing how care should be delivered and received, but it is not the focal point. So what can you do? Here's what we can do as advocates for children and for patients. I would like to empower you to find out the state of affairs in your state for telehealth. So check out the Center for Connected Health Policy. I think you can just Google CCHP. It's a phenomenal public resource. You can then contact your legislature on a policy issue that's important to you. You can write an op-ed or a blog or a tweet, share your stories, share your successes, share your challenges. This is going to matter to legislators. In order for the medical community to push and move and change the way we do things, we need pressure from families and from communities. Talk to your doctor. Do they offer telehealth? Do they offer in a way that makes sense for you? Do they know about provider-to-provider options? Do they need a little coaching on website manner? Is this something you can work through together? I encourage you to think outside the box. There's so much possible. We just need creativity and we need advocates. And so if we want to see meaningful change across the system, we have a personal responsibility to do our part. Be the change you wish to see. Thank you so much for your time and attention. I'll be very happy to take comments, questions, stories. Thank you.
Thank you very much, Donna, for a wonderful talk. Please put your questions in the chat. While we're waiting for some of these questions to come, I'm going to start. Something I learned from you when this all started is what to do or how to address when the physician sees something in the house that the family doesn't want to share. So how do families, what can you do to help families understand that we're there to help and that we're not trying to be intrusive, whether the house is disheveled or you see something that they'd rather you not see?
Yeah, I think that's a wonderful question, and I will actually welcome if anybody who's here this evening also has some strategies, because I think like any human interaction, some of this is a moving target. And we need to use our best judgment. But I think one of the things we've all recognized is, through telehealth, we are invited, and on the provider side, we are invited into patients and families' homes. And, we train our providers to be non-judgmental. We also train our providers to be advocates. And, I think at the end of the day, we need to both pay attention to the challenges, the limitations, and the opportunities in patients' homes. We had a provider who runs a obesity clinic for children, and she's able to kind of say, okay, take me around your house, show me inside your fridge. Let's, see what kind of exercises you can do. There's also those stories that we've heard where I'm, a provider, a social worker is meeting with a teenager, and she can tell that the teenager doesn't feel safe talking about certain things because maybe there is somebody in the room. And so people use the chat feature. I've seen people use the kind of thumbs up, thumbs down, or come up with a code ahead of time. There's a way to email again, or to use the chat feature. Taking a walk, suggesting that you take a walk. The goal here isn't to make people uncomfortable in the situation they're in, but it's to be able to recognize, observe, and advocate.
Great, thank you. Well, once again, while we're waiting for the questions to come up, you mentioned, and I want to focus in on health disparities. I mean, I know that there are plenty of patients that I see who don't have technology. What do we do about them?
Yeah, so that's a great question. Technology really comes in, I think, 3 broad categories. It's device, whether that's phone, like a smartphone, a tablet, a computer. There's internet. And then really there's just and maybe this is less technology, it's broadband. It's actually, what is the infrastructure around it, right? So it's not just you're paying for internet. I think one of the things that's changed in the pandemic, especially with schools going virtual, is there has been allocation of devices. There's been a lot of federal funding and state investment into the infrastructure to get broadband places. There are hotspots that have popped up, certainly around Illinois, and I know in other places as well. And so there's been improvements there, but there's also recognition that that some devices are shared across a family. And so again, that's why, in a pandemic, I think we were in a very critical time where out of necessity, we had to flip everybody into telehealth. And now I think we have an opportunity to be a little bit more thoughtful about who does it work for, who is it right for, and what can we do to make it a best experience for families, not just in the moment, but to ensure that they have the devices and the access that they need.
Thanks. Well, now we're popping up with questions. I'm going to read a rather long one. I'm going to quote, I don't see how telehealth will be cheaper unless CPT codes are created specifically for non-in-person visits. I still have to pay my same copay for a telehealth visit, and my insurance company is still billed by the CPT codes for whatever the issue is that are used for in-person visits. If there are lower costs for telehealth, that would be nice. Maybe I'm not aware of it. So can you speak to the cost, Dr. Shahnazi?
I will try, and it will be a very unsatisfying answer because I think this is really a wonderful question, and it varies. And I think it varies to the type of provider you're seeing, the type of care you're receiving, and the insurance carrier. And then it varies state by state related to the laws around it. My understanding has been during the pandemic that most insurers have actually done away with the cost sharing, meaning the copay for a telehealth visit, but certainly from your experience, that's not across the board. While some insurers say that they will pay at the same rate for telehealth as they do for an in-person visit, a lot of providers will tell you they're not going to achieve the same level of service because they might spend a lot of time, but they're not going to be able to do the same components of a physical exam. I think the jury's still out on whether telehealth services should be billed at the same rate. I think from a clinician perspective, they're still giving all of their same intellectual attention and time. But on the other hand, there are limitations. And so, again, I know this is an unsatisfying answer, and it really does vary by insurance providers, but it's a really important question, and why outcomes matter so much, because I think this is where gathering the longitudinal data to better understand, are clinical outcomes the same? Should we be charging at the same rate? And by say we, it's really should insurance companies be reimbursing or charging at the same rates?
Thank you. So here are two questions from Stacy Raymond that I'll ask them both now, and you can address them one at a time. What happens if the internet is out? Are you still charged? And the second question is, how do doctors communicate that they are running late when you aren't waiting in a waiting room? And I'll tell you, Ms. Raymond, that was one of my biggest sources of anxiety when I was doing one telemedicine visit after another, because I hate being late. So your call, Dr. Schnazi.
Yeah, I'm going to actually start with the second one. I think that, telehealth has definitely led us to re-examine how we communicate. I think, I talk about this when I teach, but, when I'm in the ER and I'm seeing a patient, I leave the room and I say, "Ooh, I forgot to tell them something, or I forgot to ask them something." It's easy enough to just open the door and go back inside. Right. But I mean, I think we can all think about, leave a telehealth visit aside for a second. If we're on the phone with somebody and we hang up and then we forgot to tell them or ask them something, how many times have you called somebody back and now they're not picking up? So for a telehealth visit, it's the same thing, right? And so how do we communicate other than that time that we're right there together? And so I think, unfortunately, during the pandemic, we didn't have as much time as I think all of us wanted to be able to really think through what the workflows were and what the processes are. And I know a lot of different clinics, in the way they have their clinic flow, where you have the medical assistant or the nurse going in first and then the doctor coming in after, have worked out a pre-visit or pre-doctor communication with the nurse, that type of thing. I've seen now a number of telehealth platforms that have really become more sophisticated and are caught up to actually providing a virtual waiting room and a dashboard on the physician side with automated reminders and messages to the patient if they can see that the provider is running late. So I think technology is going to start to catch up. And for right now, there's some clunkiness to the human factors along with it. So that's your second question. Your first question is, what happens if your internet goes out? I would say, I think that's something we've probably all experienced. I think whether it's internet going out or internet just being really spotty. My understanding as it relates to the billing, because I think that's what you asked, and Dr. Listner, please keep me honest if I miss that part of the question, but my understanding from the billers is that they really review it on the back end, and they will bill the visit as a telephone visit, meaning an audio only visit, or a telemedicine video visit in the way that it was documented by the provider. So we might start and we might talk and it's a video visit, but when it gets to the physical exam and the internet's out and we convert to audio only, I'm not going to be able to, as your physician, to chart more than the things we talked about. I'm not going to have the objective assessment in there, and that will be reflected in the way that the coders code it, in the way that it's billed.
Great, thank you. I'll just ask an open-ended question, and then if I don't see any more questions in the chat.
I still would have a question.
Oh, go on, Verena.
Oh, perfect. That was a great talk, Dr. Schnazi, and I would be interested in getting to learn about your tips that you have for families in order to optimize telemedicine health visits, particularly families with children. So in our clinic visits, the skin exam, for example, is a big focus of the exam, which is like difficult to do over camera. So what tips can we give families to optimize, the exam?
Yeah, I think that's a wonderful question. So, I think in the tips, the generic tips, I would say we talk a lot about lighting, about having a device that you're able to, you can't zoom in and out, but at least move it in closer. But I think you've really hit on a really important challenge that I think we've all recognized through the pandemic, that the skin exam is just a lot more challenging. It's hard to get really close. There's some devices that I've seen start to be developed that are basically peripherals, but they have to be purchased separately, that are a little bit better at capturing the skin exam over video. I will say by and large, and this isn't just our experience at my hospital, but what I've heard from pediatric providers and actually dermatologists around the country is that the resolution of most smartphones that most people have now is so great that if you can get a photo that way and then communicate that to your physician, whether it's through a patient portal, a secure email, that's usually, especially when you're talking about skin findings, but that requires the patient knowing ahead of time what it is you need a photo of. It's much harder to do a full body scan. Yeah. That's a really important challenge, and I'm hopeful that all these really brilliant technology experts will continue to advance on that over the years.
Thank you.
If I can just add to that, in my NF clinic visits, I let the family know ahead of time that I'd like a height, a weight, a temperature, and that if there are any specific skin concerns that they have, I ask them to take a photograph ahead of time and send it to me so that we can understanding the limitations of the skin exam and how important it is, so that I can take a look at it real time with the family. And go from there, or I have them take a picture and email it to me while we're having our conversation.
That's exactly what I do.
Yep.
If there are no more questions, maybe we'll end a little early and put some more time for the Q&A after Dr. Ulrich's talk. So Dr. Shinazi, thanks again for a wonderful, insightful talk. I'm going to pass the torch on to Dr. Stetke now.
Great. Thank you. Thank you, everybody. I am Dr. Stetke. I am an NF physician at Johns Hopkins, and also thrilled to be part of this year's NF Family Forum. And I have the great pleasure to introduce Dr. Nicole Urich for our next exciting talk. She's an associate professor of neurology at the Boston Children's Hospital, where she serves as the director of the multidisciplinary neurofibromatosis program. And she's also the director of the neuro-oncology program at Dana-Farber. Dr. Urich is a very important clinical researcher, already known to the NF community. Her research primarily focuses on the neurologic and oncologic complications of NF1. And she has also done very important work to improve academic success in children with NF1. Dr. Urich has been involved in several clinical trials through the Neurofibromatosis Clinical Trials Consortium. She also served as a member at the Clinical Care Advisory Board of the Children's Tumor Foundation and is on the board of the NF Northeast. So she's a very close member of the NF community and will be talking about coping during the pandemic today. Thank you.
And thank you for that introduction. And I want to thank the organizers for inviting me to speak tonight. This talk is a little bit of a departure from the topics that I normally speak about. And today I'm going to, the topic of our conversation is coping during uncertain times. Because I think there's the one issue of the pandemic, and then there's uncertain times, which we all have, which come upon us. So I brought up this Peanuts cartoon, so long, have a good day, and survive. And I think that a lot of us have been in survival mode during this past year and a half, and perhaps at other times in our lives. And so I thought it would be good to talk about what that means for us, generally speaking, and what that means for those of us who may have a chronic medical issue. So why me? And that's a good question. When I told some of my colleagues that I was speaking about this topic, they kind of looked at me funny that I'm not talking about clinical trials. I'm not talking about school and school interventions. I'm not talking about tumor-related issues for NF. Why this issue of coping, and what kind of experience do I have that somehow makes me an expert on this topic? Well, as a disclaimer, I'm certainly not an expert. However, when thinking about it, I think I do really have some important perspectives. Like many of you who either have NF yourselves or who care for someone with NF, I have a chronic medical issue. And so not only do I have that, but I'm also a caregiver as a doctor. And I play a lot of roles outside my roles at work that many of you may have been juggling during this past year. And I do speak quite a bit on work-life balance, which may also make my family members laugh a little bit. But I think those are really the kind of unifying features that I think of when faced with certain challenges. And Dr. Listner knows this as well, but in the last 5 years, I've had my own specific challenges, not only related to illness, but we were homeless from a fire and all sorts of other things that have been thrown at us and also thrown at our kids. So I do feel that I have a little bit of a perspective. So how did we get here? Sometimes I find myself thinking back to March 13th of 2020 and wondering what happened and how did we get here? In fact, we had just returned from a clinical care advisory board meeting in Atlanta, and things were just starting to get a little bit squirrely in terms of travel. And then all of a sudden, for everyone, things shut down. And it's so hard to think about how things were before COVID-19. These are unprecedented times. There's no way that we can kind of use anything from the past to map out our reaction to COVID-19 and how do we know what's coming next? Because as the cartoon says, but wait, there's more. It does feel that every time we round a corner that there's some new surprise. There's a Delta variant, there's a new complication from COVID, there's a complication or concern related to the vaccine. And how do we deal with all that information that's coming in at any one time? There's no question that all of us have experienced some increased anxiety, whether or not it's about ourselves, our job, our children, family members, parents, things like that. And sometimes that's turned into even waves of panic, grief, or uncertainty. For some people, they had job insecurity. And this is even physicians who had job insecurity or who lost their jobs or who were moved into other roles that they'd never played before. Pediatricians somehow seeing adult patients or covering the ICU when they hadn't been in the ICU for many years. Food insecurity, certainly. I've seen lots of different statistics on the percentage of individuals who have some element of food insecurity. I spoke to a family the other day by telemedicine, in fact, and they did report some food insecurity. And I think that's one of the things that I've really tried to ask about when I'm meeting with families, both in telemedicine and in person, to make sure that they have ability to access food, ability to access their medications in particular, and that they're not scrimping on taking their medications because they can't pay for the copay or they can't access or get transportation. The family that I spoke to the other day was in fact having difficulty getting to the medications and had been using 4 or 5 different food pantries in order to secure enough food to get by. Despite this, there are moments of hope and resilience. It's not all bad news and gloomy, but everybody, I think, is struggling in some way or another. So I mentioned that I sometimes talk about work-life balance, and for many of us kind of thrown into the role as a parent or caregiver, a childcare provider, a teacher, an educational support person, an IT specialist, a short order cook, a transportation specialist, or a parent Uber. My kids call me the Moober or the mom Uber. An employee, a general, you could be a patient as well yourself, and in general, the coordinator of chaos, which is what I refer to as my role at home. There's a lot of extra roles that everybody is playing during the pandemic. And one wonders as the day goes by, where does it all go? Because certainly it feels like many of us who have a job that's not a regular hour working job, sleep less and work all night long to make up for the fact that they're busy doing all the teaching and other roles at home. So this is my favorite mouse here, not an experimental mouse. And he says, yes, I am a bit stressed. Why do you ask? Stress can cause a lot of physical changes and physical feelings. It can cause feelings of fear, anger, sadness, worry, and frustration, in addition to changes in appetite in either direction, energy changes in desires and interests, as well as difficulty concentrating and making decisions. A lot of people had difficulty sleeping or even nightmares and physical reactions. So it's not uncommon that our body's response to pain is often to produce physical symptoms. These can include headaches, body pains, stomach problems, and even skin rashes. And I think two things that I want to highlight here are worsening of chronic health conditions and worsening of mental health conditions. Those of us on the medical side know that all of our emergency departments are chock full of people who are waiting for access to psychiatric care. This is particularly true in the pediatric hospitals, where there are children who are boarding in the emergency department, boarding on the medical floors, because there's just no space. And in the community, it's very difficult to find access to mental health providers. During the pandemic, there's also been an increased use of tobacco, alcohol, and other substances. And I want to take a moment to talk about the health impacts of the pandemic. So a chronic illness is defined as a disease or disorder developing slowly and persisting for a long period of time, often for the remainder of the lifetime of the individual. And certainly we would put all the types of neurofibromatosis into this category of chronic illness, which of course I don't need to share with you. And I do have a taste of what that feels like in terms of having a disease that at times is not well known in terms of how to predict and is likely to be progressive and for sure will last the remainder of my own life. So there have been some studies that have looked at how COVID has impacted routine living and disease management of patients with chronic disease. And these were yes/no questions given to patients. And you can see that in terms of regular testing, about just over half of individuals said that they were getting less of this due to COVID. This is also true for routine checkups and access to medicines, because of medicine price or availability of medicines was reduced in about 2/3 of, was also reduced in a significant number of persons. Importantly, also about 25% of individuals were not taking their medicine regularly, and half of them were not getting daily medical care, and many more were not getting exercise. So all of these things, this happened to be in a diabetes population. However, this is relevant to any particular person who has a chronic medical issue, where it's so important to continue to get all of your regular checkups, your regular testing, taking all your medications, and getting up and moving. So I came up with some tips on thriving during uncertain times. This is the proverbial fork in the road. And I think all of us have been in this spot before where we're stuck. And so I like to think about these as what to do when you don't know what to do, and some guiding principles on how to think about and tools for coping. So if you remember nothing else, this slide is really important. In terms of coping with COVID-19, you can see I didn't come up with this myself. This is from the National Institute of Mental Health. And they came up with 6 key factors in terms of coping with COVID-19. The first one is to take breaks from the news. I can speak from a personal perspective that I am married to a person who has been glued to the TV throughout the pandemic. And despite the fact that I'm a doctor, nobody else is in the medical field in my family. My interpretation of what's going on with COVID-19 is not sufficient. He only believes a certain number of people on TV, and that includes Fauci and a few other on the news. And he is glued to the television. When we watch one set of news, he flips over and watches the other set of news, and then the recap of the news, and then yet another set of the news. And I think after a certain point, it became very clear that we needed to take a break from the news. And as a corollary to that, focus on the facts, because so much different information was coming out and is coming out that's sometimes hard to interpret. And depending on which news channel you watch, you may find very opposite interpretations of the medical facts. It's really important to make time to unwind, and I have some examples of that. I think that that's probably one thing that's gone away for a lot of people, is making time to unwind as well as taking care of your body. I used to ask kids during my telemedicine visits what they get for exercise. Now I actually ask them if they leave their house, because a lot of kids just weren't leaving their house. They were on Zoom for school, and they were on the computer all day long, and often didn't get out of the house, even if they had an animal who needed to be walked. And I think a lot of kids' mood and was impacted by that, not only not seeing their friends, but also not getting out and outside the house. I personally find it super important to connect with others. In the beginning of the pandemic, it was very clear that we were all kind of siloed from one another, and how important it is to see other humans, initially just by Zoom, and then more gradually in person at a distance. And I know that that is particularly helpful to find that connection. And then the other one is to set goals and priorities. Many of us working at home found it very difficult with the blend of home and work to find some balance. No matter where you go, all of your work is sitting there. And that is a particular challenge, and also a challenge as people are transitioning back to in-person work, to try and figure out how that's going to happen when it's not totally clear how the educational system is going to work moving forward. So one of the things I try to think about is working well enough from home. I actually personally felt that working from home worked out well, but it can be challenging. The kids were almost always at home, and I have 3 teenagers. So there were 5 of us on the internet at any one time. And I had to remind them to make sure they were clothed when they were walking through the living room, to make sure they didn't show up on my Zoom visits. I think we all have to recognize that productivity may not be the same. And what I found helpful was to confine my workspace to a specific clear area, and I'll show you a picture of that. I also found it helpful to control the sound, because we had people on competing conference calls in other rooms. And but it still happens. The neighbor was cutting down a tree the other day during the International NF Research Conference, and I had to move to a different location because nowhere in my house could I go that you didn't hear a tree coming down. And I think it's also important to end the workday with clear boundaries. When we go into work, we actually leave work generally at the end of the day. Many of us do work at home later in the day. However, the recommendation is that you cut yourself off and leave the workday behind. And many of us have found it helpful to have a team meeting either at the beginning of the day or the end of the day, just to kind of bring people together and review any issues that have come up during the daytime. I like this one, both because I aspire to this and because it reflects the amount of space that I have for my home office. And I think it's really important to find a space and call it your own. My children have renamed it the corner of shame. I'm not quite so sure why that is, but I particularly like my little corner. And while it doesn't look like the one in the design catalog, I do have a really nice view of the outdoors, and I can see my hammock chair, and I sometimes move into the hammock chair if I don't have to be on video. And that is my space. And when I'm done, I leave everything on that space. And so I think it's really helpful to me to have it kind of tucked away. It may be their corner of shame, but it is my corner, and I can tuck everything away and not have to think about it all the time. I think it's also really important not to schedule every minute of every day. And this gets harder and harder the more roles that we take on, particularly as parents and caregivers, that we're trying to squeeze in new activities. And inevitably, the one thing that suffers from that is also sleep. And it continues to increase anxiety. And so I think it is important to have a schedule, but not to have it so scheduled that you're just racing from one task to the next. And this is a really important one, both if you are a patient and if you are a parent or a family member, you must take care of yourself. Whenever we're on an airplane, we hear the announcements, and it says, in the event that the plane loses cabin pressure, while at altitude, oxygen masks will appear overhead. Please place the mask over your own mouth and nose before assisting others. And this is really key. It's very difficult to be of service to others if you don't help yourself first. Along those lines, I think this is a really great cartoon. You wouldn't let this happen to your phone. I promise you my kids don't let their phone get below 49% or they're in a panic. And so I think it's important to remember that we shouldn't let this happen to ourselves. Self-care is a priority. It is not a luxury. And if you don't take care of yourself, then you can't do any of those 50 different roles that you have. And that includes taking care of your body. There are lots of different things you can do. You can go for a walk. You can make your favorite food. You can get a haircut. You can cry if you want to or you need to. You can read a book. You can have a drink, and by that I don't necessarily mean an alcoholic drink, but you need to take care of yourself. That means getting enough sleep and exercising and trying to eat healthy. I promise you my plate doesn't look like this. It's something I would aspire to. I'm not sure I've ever achieved it, but good nutrition does help our mood. Stress definitely makes us seek comfort foods such as high carbohydrates and sugars, and junk food is linked to depression and anxiety. So the more that you can do to keep a regular set of habits, especially if you're at home or working from home, is really key. And it is really important to take your medications. This is our minion who says it's a beautiful day. I think I'll skip my meds and stir things up a bit. I know that when we skip our meds, we're not actually thinking that, but I think all of us have felt good at different times and felt that maybe I don't need to take those medications anymore. Or importantly, I don't have enough money to pay the copay for those medications. So maybe I could just spread them out or take them every other day or things like that. There are lots of ways to access supports and funds to do medical copays. And so I think it's really important to remember to take your medications, and along those lines, not to ignore medical care. You know, I think when we're in this endless sea of days that continue on and on and on during the pandemic, there are lots of things on our lists, and it's easy to kind of keep putting those off. As you heard in the talk that just came, many providers are doing telemedicine. That's also true of NF providers. And there was a study that came out of the Clinical Care Advisory Board that looked at access to telemedicine. And while in the beginning, there were many different clinics within the clinical care network who did not use telemedicine, by a follow-up period, many were. And this is really important. I think it's provided a lot of access for NF care in places that didn't have such geographic access to NF care in the past, and allows some check-ins. I'm really personally hoping that telemedicine does continue, especially for NF care. I don't think it's going to solve everything, and there are times where an in-person visit is just so important. It can't be replaced, but I think a lot can be handled by telemedicine, and I hope that the insurance companies continue to support this moving forward. It's also really important to continue routine preventative measures. And that includes getting your blood pressure checked, getting your eyes checked, getting your imaging studies done. I put on here, stay physically safe from the virus. I happen to live in a state where the rates of vaccination are very high. I know that's not universally true, and it's really important to get vaccinated. There's lots of information and misinformation around concerning the vaccine. Having a diagnosis of NF schwannomatosis, NF2, does not increase the risk of COVID. And in fact, the risk of COVID complications is much greater than any complications from the vaccine. And COVID in itself increases risks for clotting and heart-related complications and stroke and things like that in a far, far greater ratio than the vaccine. So if you haven't done it yet, it's not too late. Please go get the vaccine. And as I mentioned, making time to unwind is super important. And I find that it's super important also as a physician. That happens to be me over in the lowest seat that you can see in the picture. And in all the crazy of the pandemic, getting out on the water and rowing has been something that's helped me keep sane. And for each individual person, that's going to be something different. That could be meditation, that could be reading, that could be being a goofball in an inflatable ball, that could be knitting, could be walking, could be anything, but it should be something. And so that in that 24-hour clock of the day, that you make sure that you have some wedge of the clock that's just for you, your mental health, and taking care of your body. And I put this on here only slightly in jest. It's still important to do things like wear deodorant and pants. As I mentioned, I have to remind my children to wear pants when they're walking behind me and I'm on a Zoom call. And I know a lot of people tend to dress down in the part that's not visible on the Zoom call. You know, I personally find it helpful to get dressed as if I'm going to work, and it puts me in a mindset of being at work, and then I can dress down when I'm done and kind of shut off the work. And so all of those things in self-care can go out the window, and has for a lot of people who are getting more and more casual as time goes by, but it is important to be clothed. And then it's important never to worry alone. In the middle of or summer of the pandemic, I started to walk at least once a week on the beach, which isn't quite so close as I wanted it to be. But I meet friends once a week at least to watch the sunrise. And we actually do take a dip, and that's been since January. So the connection that I feel in seeing others is huge. And we can share our worries and talk about things. Not that I can't talk about that with my family, but I think it's really important to never worry alone, and to be able to reach out to others. And then the other thing is to ask for help and accept help. Asking for help is really, really difficult. I know it's difficult for me, and accepting help is probably even more difficult. But this is a time where we all need help with one thing or another. It could be being the kid Uber. It could be getting a meal. It could be anything. And it is important to ask for the help and accept help. So important not to forget that. And this is a quote by Maya Angelou. Try to be a rainbow in someone else's cloud and find ways to express kindness, patience, and compassion for everyone. That's something that I've personally taken to heart. My kids and I once a week go to the food pantry, and we pack up the car with food, and we make deliveries every week. So I feel like that brings them a better understanding of other people who may have food insecurity, and helps others. So I think I'll stop there if anybody has any questions.
Dr. Ulrich, this was an excellent talk. We're still waiting for questions to come in, but to just echo some of the things from the chat, that there were a lot of attendees who really appreciated the talk and thought it was really wonderful information, and I want to echo that. I think one of the question I have is, what kind of coping strategies have you noticed in children, particularly in your patients, and whether you feel that our children with NF, whether they had more difficulties with coping through the last couple of months than you would expect from children?
Yeah, that's a really good question. And I know that Dr. Walsh is going to speak tomorrow on school and education. I have worried a lot about the kids that I care for who have NF1 in particular, who may already have had some challenges educationally. And I think access to services has been quite challenging. So some schools were more readily able to provide ancillary services, PT, OT, and extra help by Zoom. But not all kids can really access those services by Zoom. And we found that there was definitely a group of kids who were falling through the crack a bit in terms of access to services that they were due from their IEPs. We have an educational program within our NF program, and we have an educational specialist who was able to pivot and do Zoom meetings with the families and the schools at the same time, and really help negotiate and navigate families through the process. We also created a series of Zoom casts to help families react and respond to the COVID pandemic in terms of how to access services, how to formally submit a complaint if there were issues with the Department of Secondary Education, and to try and bolster people up in terms of getting appropriate services and testing at the schools.
And
I think the repercussions are going to be here for a long time to come, unfortunately.
Right. And from your experience, have you felt that the NF community had more difficulties with coping through the pandemics, or, yeah?
My patient population is a bit biased because it's pretty much all NF. So, but I do think, from personal experience and then experience as a physician, I think that kids who are the most vulnerable are those who get educational supports, such as a 504 plan and an IEP. And since many kids with NF fall into that category, I think that can be very difficult. Also, some kids with NF really do have difficulties with social relationships, and trying to take that into a Zoom format or whatever kind of format the school used, I think was very, very difficult. Also, if there were baseline issues with attention and focus, for many of us understand, being on a Zoom call, that it's even more difficult to pay attention. And so I think many kids with NF were very vulnerable during the time of remote learning.
I have a question, Dr. Secchi, if we have time for one more question.
Yeah, we do. Thank you.
Dr. Ulrich, I mean, as a pediatrician, one of the biggest sources of morbidity I've seen both in the NF patients and the non-NF patients in this over this pandemic is excess weight gain. It's a universal phenomenon. Besides the fact that kids aren't getting immunizations, you have, I mean, is this something you've noticed, and do you have strategies to try and combat that?
I think that the weight gain and the mental health issues, I would totally agree with both, that those are probably the two biggest issues. And as I mentioned, I used to ask kids how, what kind of exercise they got. And now I ask if they leave the house. And so I talk with the kids too and try and come up with a plan. Usually I'm coming up with a plan for having them drink more water at the same time. And so I don't expect that they're gonna like go out and run a marathon, but I do try and come up with a plan with them and the parent there about they're gonna walk the dog, 3 days a week. They're gonna, slowly, and we come up with a plan and a strategy for how to increase the physical activity, because I think it's important both for their physical and mental health.
I also think it's the universal access to food 24/7.
Yes, yes.
Yeah, there's in fact another question that just came in from an attendee who's asking whether you think that the anxiety is generating excessive desire to eat, or whether the reaction is due to the quarantine and perhaps the lack of mobility because we're not leaving the house, the excessive weight gain.
I don't think that NF is causing, if I understand the question correctly, I don't think that the NF itself is causing an increased desire to eat or increased appetite. I think, as Dr. Listner said, more readily access to food. I mean, we're not used to being 10 feet away from our kitchen 24/7, which we really all are. And the anxiety combined, I think, has made people more likely to overeat and eat on junk food. Also, junk food is less expensive. So if people are food insecure and they're going to buy food, the access to junk food and less inexpensive food is easier. And I think someone else commented, now that people are vaccinated and or wearing masks, there are more people getting out to exercise and walk, which is true. And I would say definitely me also. The weather's changed as well. So I think that's been helpful as we've come through the winter.
Yeah. Okay, I think we're almost we are like almost towards the end. So thank you, Dr. Ulrich, for answering the question and for this excellent talk. There is one more question left in the chat, which if you have a chance to answer that would be great. And I will now introduce the next speaker, who with the closing remarks, which will be Danielle.
Verena, Danielle, if you don't mind, we just need to share one video before you close out.
Oh, sure. Yeah.
No, that's fine. So, yeah, thank you, Dana and Nikki, for speaking on those important issues. I believe we'd just like to share with you an overview of CTF's groundbreaking initiatives and strategic plan for how we're collaboratively exploring current and future research directions in NF, with your involvement certainly as patients. So Nikki, if you could do us the honor and call up that video. Thanks.
I'm Annette Bakker, President of the Children's Tumor Foundation and Vice Chair of the Children's Tumor Foundation Europe. At the Children's Tumor Foundations, our mission begins and ends with the patients affected by a genetic disorder, neurofibromatosis, also known as NF. Our goal is to end NF. Doing that requires an entire ecosystem of doctors, researchers, companies, and regulators so that new therapies can be discovered, developed, and finally delivered to patients. But too often, the pieces of this big system are disconnected from each other, working on their own. And despite the hard work everyone is doing, new information and new ideas can get stuck, blocking of slowing the discovery, development, and delivery needed to get new therapies to patients. Because of what's missing, connections. That is where we come in. The Children's Tumor Foundation is the world's largest nonprofit medical research organization focused on neurofibromatosis. And we do what no one else can. We connect the unconnected so that our patients receive new treatments faster. We catalyze new discoveries by investing in research, and we enable the path to better treatments. And we work with all stakeholders to speed the delivery of effective and safe treatments to our patients. Our NF Clinic network connects with doctors to make sure all patients are receiving standardized quality care. We also work to improve access to clinical trials where potential new drugs are tested. We bring together the NF research community at our NF conference, which is the largest of its kind, and really bringing in top minds from all over the world. CTF also works to catalyze discoveries in two complementary ways. With the Discovery Funds, which funds the best and most promising ideas from bench to bedside, and through the Synodos model of team science to tackle the most complex problems that no lab alone can solve. Driven by patients, multidisciplinary by default, and requiring open sharing of data and resources. The Children's Tumor Foundation has built a platform to attract pharmaceutical companies to NF. Our NF registry and clinical trial endpoints help accelerate clinical trials of new therapies. Our target scan matches new biological discoveries to existing drug. Our data hub makes information widely available to all who need it. Our clinical initiatives will help find new and existing drugs that haven't been used to treat NF yet. And we already partner with many companies and are always open to innovative business opportunities which accelerate the path to a cure for NF. Finally, the engagement of NF patients is central to our work. CTF-trained patients are equal partners. They're evaluating clinics, participating in research grant reviews, in the development of clinical trial endpoints, and helping regulators and companies better understand what it means to live with NF. Our new model has already resulted in innovative clinical trials for all forms of NF, promising results in clinical trials, and the first ever approved drug for NF1. This is possible because of our connected and united global community of patients, researchers, advocates, business partners, regulators, and donors working towards one common goal: working with people, for people, all laser focused on ending NF.
I wanted to wrap up this evening thanking our wonderful speakers tonight, and we look forward to seeing you all tomorrow morning. We'll begin at 11 a.m. We will give you links throughout the chat, and you may have received an email as well, but we will guide you along the way to various sessions. Thank you so much for spending your evening with us tonight, and we look forward to seeing you in the morning. Have a great night.